Good evening, and welcome to part 2 of the trauma series addressing the African American community, hosted by the Purposeful Partnerships of the Collective. The Collective includes the National Coalition of 100 Black Women and Arundel County Chapter, Arundel Bay Area Chapter of Jack and Jill of America, North Arundel County Alumnae Chapter of Delta Sigma Theta Sorority Incorporated, the Anne Arundel County Chapter of the NAACP, Rho Eta Zeta Chapter of Zeta Phi Beta Sorority Incorporated, Lambda Delta Sigma Alumni Chapter of Sigma Gamma Rho Sorority Incorporated, and Delta Pi Omega Chapter of Alpha Kappa Alpha Sorority Incorporated. Welcome. If you tuned in last night, you heard from an esteemed panel who spoke about trauma and African American men. And if you didn't, you missed a great discussion. Make sure you go back and watch it later. Last night, we discussed the healing ointment necessary to begin trauma care, healing of men, and actually, we talked about the community as a whole. What we learned last night was that we need to be intentional, individually and collectively. That's men, women, and the community. And that by falling in love with ourselves first, then we have the capacity to lift others. We were also reminded of the institutions and the importance of the institutions of family, education, and faith. If those institutions are not present, then ultimately we will face police, courts, and corrections. Ladies and gentlemen, trauma is real and it is prevalent. It impacts all of us. And over the next 2 evenings, we will focus on specifically trauma in the African community. But as I said, trauma impacts everyone. Tonight, we will be discussing trauma and the impact on African American youth, specifically, but youth as a whole. We are streaming live again on Facebook. And so we'll be addressing questions from Facebook and our Zoom platform. This evening, it is my pleasure to introduce our esteemed panelists this evening, experts in the field who are making a difference, who will share with us from their perspective on this topic. I am Sean Ashworth, and I work for Anne Arundel County Public Schools, but tonight I'm representing North Arundel County Alumni Chapter of Delta Sigma Theta, a purposeful partnership in this collective. Tonight we have Dr. Pamela Brown. Dr. Brown is currently the Executive Director of Anne Arundel County Partnership for Children, Youth, and Families, and throughout her career, she has worked on addressing inequities across government and educational systems. Then we have Ms. Shirley Jackson Avery. She is the Counseling Coordinator for Pre-K through 8th grade for Anne Arundel County Public Schools. Ms. Jackson Avery facilitates professional growth and development for over 260 school counselors. Last but not least, Ms. Kenyatta Hazelwood.
You have to stay with me. I was just asking you about.
She is the Director of Trauma Services in Howard University Hospital Level 1 Trauma Center. She has done lots of work in trauma and prevention. Tonight, each panelist will take approximately 15 minutes to share their thoughts on the topic. But before they get started, I wanted to share just a little bit of data. And we've all seen and heard this data, that the data tells us that Black children are more likely than their white peers to be exposed to a threatening experience and exposed to complex trauma. In addition to the high rates of exposure to trauma and other types of adversities, our African American children and families, they must also cope with the effects of historical trauma and the intergenerational legacy of racism. This trauma causes toxic stress, and toxic stress in children cause psychological disruptions or some dysfunctions that lead to adult depressed outcomes later in life. What and how we address and develop support is critical to minimizing behavior and health outcomes in adulthood. So the work we do as communities must be intentional. The need for equitable opportunities for access to mental health resources is a must. And in regards to education, we must be intentional with strategies that focus on social emotional skills. It is necessary. And of course, we have this ugly pandemic that we're still dealing with. And we know that that only created another level of toxic stress among our children, and especially in the African American community. So, Dr. Brown, I wanted to start with you because you are an expert. You have done all kinds of data search and researching about the plight of all families in our county, but I know you've also specifically looked at our disadvantaged families. And so let's hear from you, Dr. Brown. What's your take on this?
Well, I'm going to start with just some demographics because I think that percentages are important when we talk about overrepresentation and disparities. So I think it's really important to understand what we're talking about. Here we see a couple of trends, a couple of pieces of information. We can see that the white population make up about 68% of our population. And you will see that African Americans in 2019 now make around 17%. I hope you can also notice that the white population is shrinking and the African American population and the Hispanic population are growing. We can see our child population aged 0 to 18. We'll see it's slightly less white. It's 60% white, a little less than 60%, and almost 19% African American, with again, this growing Hispanic population. That's just so that when we talk about percentages, you understand that we're not talking 50-50. It's helpful when we talk about that. Next slide, please. So I've spent a large part of my life looking at economic disparities for children and what it means. And it's really only in the last 10 years I've started to look at how race plays into that and why. So here's our percent below poverty level for Arundel County on the left, the ones with the bars, and you will see white, black, Hispanic, and Asian. What's important is the height of the bars for the African American population to begin with. That's the second one, and also the Hispanic population. But I want you to also see that where between 2016 and 2019, the poverty for the white population is falling, the poverty for the black population is rising. And then we look at something that is extremely important for children, the numbers living with single females. And again, you will see that whites are only 10% by 2019, African Americans at 17.4%, and Hispanics at 24%. So again, by race and ethnicity, we start to see disparities occurring. Look at median income. For some reason, it is improved by 2019. I don't think that we will see that improvement last through 21. That is a bit of an outlier. But again, you will see in terms of median household income, there's a disparity between race and ethnicity. Next slide, please. So we've already got what we understand here as a disparity around economics. So we know that African American children are living with that disparity. But that starts long before birth. Because if we start looking at what happens to African American women immediately that they're pregnant in the first trimester, you will see that although the gap is closing, our African American and our Hispanic population are far less likely to receive that first, very important first trimester care than white families. And next slide, please. And we get to preterms, children who are born preterm. And again, there's a gap for preterm births by race ethnicity, and also for percent of low birth weights. And low birth weights is very high for African Americans. It's almost double. In fact, it's actually, it's almost double that of whites and that of Hispanics. And I'll talk a bit more about why that is, but my next slide, please. It's the relationship that's important here. So if you look at the causes of infant mortality, and please look at what's happening to African Americans in 2019 and that spike in mortality. How much, when you look at the graph on the right, when we talk about causes, it's related to that preterm low birth weight piece. So that feeds right into the infant mortality slide that has that African American rising. Now, for some reason in 2018, it's almost like a blip. We did something well, but right back up in 2019. So our trend line is not good there, and the gap is extremely clear. We don't have good Hispanic numbers around that, so they're just plot points. I don't plot them because they vary from year to year. So next slide, please. So I'm hoping what I'm trying to explain here is that our children, way before they're born, our African American children, are already at a disadvantage. And then we got to start talking about what I've started to call baked-in inequities for African American children. And one of the most telling statistics around that is the one on the left, percent owning a home by race and ethnicity. And I've actually highlighted our African Americans, 54%. Our whites are at 80%. That is an enormous gap. And here's what's important, the bullets underneath. Most of that gap was quite purposeful. And I think this is very hard for white people to understand. There were purposeful policies, redlining, the GI Bill, the way they structured the GI Bill for 1.2 million Black veterans, that is actually led to what we're looking at here. This actually, obviously, is always about economic disparity, but more to the point, it is about purposeful policies that cause this to happen. Basically, the system saying, we're going to draw a red line around these areas, and in those areas, we are not going to give mortgages. And I will say, as I say that, if you take food desert maps, you can map them to redlining maps. And the reason you can do that is because grocery store owners chose not to put their grocery stores in those neighborhoods. So if you wonder when I talk about my neighborhoods, why I talk about there being no grocery stores, that's one of the biggest reasons why. Again, purposeful structural policies to make that happen. It wasn't by accident. We can also look at residents lacking health insurance. Now, we're really lucky in our state because we have something called enhanced Medicaid. It doesn't see color, and it means that all of our children who are low income can get health insurance. But even with that, guys, you can see that when there's a gap, African Americans in percentages are far more likely not to have health insurance than whites, and obviously to a greater extent Hispanics, often related to their immigration status. So next slide, please. So now we come to neighborhoods, and I'm sorry for those of you who get to see my maps far more often than they should, but as I looked at all of the disparities related to very low income children, I realized that there was a color and a geography to those issues. They're what we call social determinants. We've already talked about low birth weight. We can look at high school diploma. We can look at income. We can look at food deserts. We can look at lead in the pipes in schools. We can look at bad water, and we will find this pattern of a geography and color across our county. And those neighborhoods, we know where they are, and it doesn't matter what I plot. They will be the highest, and they are always disproportionately African American. Next slide, please. So just one more think about this. Black households report food insufficiency. That's our nice, kind way of saying hunger, 3 times the rate of white households. You can see our food environment in Arundel County. You can see it matched to the African American population and the households below poverty, and you can start seeing the matchup between those things. So we have this very clear indicator, and again, we can also match it back to systemically racist policies that cause some of these things to happen. So next slide, please. So I'm just going to pick food, and I'm going to tell you what happens with hungry children. And remember, we are now talking about African American children being disproportionately hungry. They're more prone to fighting, hyperactivity, aggression, anxiety, mood swings, and bullying. So that could explain some of the things that are happening in our schools. Children in families who don't know where the next meal are coming from, they have lower test scores. Remember all that talk about the achievement gap and test scores? Hungry kids are more likely to skip school, have to repeat a grade, or not finish school at all. And they're also more likely to suffer chronic health conditions such as anemia, asthma, and require hospitalization. So all I've done here is taken one of those indicators where African American children are disproportionately represented and just look at the consequences of that. So next slide, please. So we have communities of hope in all of the neighborhoods that you saw on the map. And we call them communities of hope because we're focused on them and we're trying to address issues that are in them. They are in Brooklyn Park, they're in Seven Mead, Pioneer City, they're in the public and low-income housing in Annapolis, and they're in the mobile home parks and some of the African American areas of South County. And what do we know about them? They're disproportionately African American. They are low income, very low income, living in poverty. They are impacted by their adverse community environments. I'm going to talk about that in a minute. They suffer from health issues. They've got hungry issues. The houses are rent overburdened. They lack transportation. There's often an incarcerated partner. And if we want to talk about structural racism, I should mention that 70% of our prisons are in Maryland are African American. And then all of the economic and racial disparities and systemic racism that lives inside those neighborhoods that happened over time. And next slide, please. So we are talking about years of collective trauma, bad housing. And I will say that public housing in Annapolis, and Miss Peters told me this a long time ago, it was unsafe and substandard housing when it was built. And so it became public housing. It was substandard when it was built. So if you think about everything I've said so far, and the fact that all of these things live inside neighborhoods, you can start talking about the collective trauma of that, the desperation of that, the despair of that, living inside neighborhoods. They're areas where the symptoms of trauma and post-traumatic stress are clear, and we see evidence of it every day. I always remember when we first started working in Pioneer City, there had been an incident there, and one of the women said to me, "Our whole community is hurting," and she wasn't talking about Arundel County; she was talking about her neighborhood. And I don't want to give anybody an impression here that these neighborhoods are not strong and resilient. They are extremely strong and extremely resilient. So I don't want to give anybody that impression as I talk. Next slide, please. We talk a lot about the pairs of ACEs. So unfortunately, adverse childhood experiences, and I think that we've already talked about this in the series, they are the things that happen to children that create all sorts of physical and emotional damage. They tend to live inside adverse community environments where racism has created issues, where there's discrimination, lack of opportunity, poor housing quality, and violence. They all live together. And so it really is about both things working together to make that lack of opportunity for our African American children and create a system where they live in trauma, both at home and at school. And next slide, please. And we see in the ACEs themselves, there are consistent and robust disparities among white and Black children. These are national numbers because I don't have local numbers, but 61% of Black children versus 40% of white children have at least one adverse childhood experience. Their Black children are far more likely to suffer economic hardship, bias, discrimination, etc. Families of color, as you know, are particularly vulnerable to economic downturns. And so the pandemic was a nightmare of epic proportions, disproportionately for our African-American communities. They were far more likely to die of COVID. Our neighborhoods were far more likely to be impacted economically. The children in those neighborhoods were less likely to have the sorts of advantages that would help them through the pandemic. So when our African-American children came back to school, they were grieving more, they were more traumatized, and they were less prepared. Next slide, please. And so we can see the impact of all of these things in mental health. And I want to talk to you about that because I think it's really important. I hear a lot of people now talking about how African Americans need more mental health treatment. And I think that's probably true, but it's because of what has happened to them. There is a situational piece to that. There's a trauma piece to that I feel like I always have to talk about in advance. Otherwise, the picture is not clear. That all the things have to work together. Yes, we have to treat the consequences of all of the years of all this, but we also have to start putting right some of the economic disparities and the structural pieces that have led us to where we get. I will tell you that what we do know about adverse childhood experiences is that the higher the ACE score, the more likely you are to suffer from depression, the more likely you are to have an attempted suicide, the more likely you are to be an intravenous drug user. So that early impact of trauma, you couple that with all of the other things that African-American children deal with on a daily basis, and it is a perfect storm. I don't know that is my last slide, but it might be. Is it, Sean? Just one more, just to sort of hammer the point home about COVID, because it's where we are. Our kids have just gone back to school. Our African-American kids have gone back to school. And if you see what happened disproportionately, African-Americans, 17% of the population, 27% of the deaths, 22% of the cases. That's an important number because it means in our neighborhoods that we're already disproportionately impacted by a whole set of trauma. We've now added this new set of trauma on top of that. And I will leave it there. And that's where we are.
Thank you, Dr. Brown. And you talked about a lot and I have so many questions. But one thing that I just want to, before we go on to our next panelist, I just want to, did y'all hear what Dr. Pam said about purposeful policies? That is scary. And so my thought is, in so many ways, and I'm out and about, are those still happening today? Do we still have purposeful policies in place? And is that the reason why we continue to have disproportionality? I'm throwing that out for anybody to answer. I just thought that just blew my mind. Dr. Mallory, what you got to say? I'm bringing you on into this conversation real quick.
It's supposed to be my night off, Sean.
I know, but I know you got something to say about this.
First of all, I want to just thank the speakers so much for a brilliant presentation that really is both political and historical in nature, that explains the underpinnings of why we see what we see. It's so very, very important. The question that's been asked to me, collaborative, is do we still have these purposeful policies in place that undermine healthy communities, that undermine sane children, that undermine the ability to achieve nutrition, the ability to go to safe schools, the ability to live in a community free of feeling as though you are under attack? And the answer to that question is, of course we do. Yes, we do. And we define, it's so prevalent now that we have multiple names for that. Now, so some people, if you look at Johann Gottling's work, he talks about structural inequality, right? Structural violence. That means the way in which our communities at their very core or structure, how society begins to constrain individuals' ability to succeed and be successful by virtue of the structure of the society. Food deserts has been spoken to quite eloquently. Dysfunctional schools have been spoken to. Broken playgrounds, lighting in neighborhoods, inappropriately repaired streets, and we could go on and on. There was a time we had cross guards in communities to make sure children got across streets safely. When cross guards disappear, what happens? And so Oprah Winfrey back in the 80s put her money behind a epic series. And the title of that series was There Are No Children Here. And she was pointing out these structural inequities. She was using her platform to show that these inequities, okay, basically rob us of our children because the ACEs, the adverse child experiences that have been talked about, begin to build up. And at some point, you don't have a child anymore that's innocent. And so when we bring in children into Howard University to do the Engage program, empowering the next generation to achieve greatness, and I ask the children, how many of you have seen violent acts up close? And 80% of the hands go up in the air. That person is being robbed of the innocence of their childhood. They're not a child anymore. And so the answer to your question is absolutely. And so we're trying to run back to the way things used to be. And so if you talk to any Department of Health individual, they will talk to you about a health in all policies strategy, by which we begin to try to incorporate health in everything that is considered before our legislature. But that's a slow grind, and it often takes it often takes a minor role to other issues such as taxes and jobs. And so we have to be very cognizant that what our speaker has told us is so correct. Dr. Brown is right on it. It is a purposeful policy that generates exactly what we see.
Wow, I just thought that was, that was deep. Thank you so much, Dr. Williams. Ms. Kenyatta Hazelwood, so I know you work over there with them nice working people in Howard University Trauma, and you are doing some great things there. Talk to us about what's going on in DC in your trauma unit and how you are addressing.
Absolutely. Thank you so much for having me here on the panel and in the discussion today. So one of the things that we recognize is that the CDC has said that injury is the #1 cause of death for ages 1 to 43. And so often we think about heart disease and other disease processes, but injury really kills Americans more than any other disease process. And when you talk about children, how they get to those injuries, whether it is a violent injury or swimming injuries, whether they are motor vehicle crashes or distracted driving, those injuries are come about often because of lack of education and lack of parental guidance in some of those areas. So the trauma for children really starts young. The CDC says that 2 out of 3 children reported at least one traumatic event by age 16. And that each year, the number of youth that require hospital treatment for physical assault related injuries can fill up the seat in 9 stadiums, 9 football stadiums, if you think about that. That 1 in 4 high school students has at least one physical fight, that 1 in 5 school students has been bullied in school or have experienced cyberbullying. And so when we talk about post-traumatic stress disorder, which we heard Dr. Brown talk about, 19% of injured and 12% of physically ill youth have post-traumatic stress syndrome. And those numbers are all higher in the Black community. And one way that we know that happens also starts at the very basics of equality and equity, right? And we talk about those two things, but as we know, they're very different. If you have equality and you give people the same resources, you give two people $100, for example, you should give the person who's rich the 100 and the person who's poor 200, because you know that they have more resources, they have more things that they need to do with that $200. So students, even when they have equal resources or equal resources across the board, what they don't have is equity. They don't have what they need to make those things happen. So at the time that they come to us in the trauma center for, again, all those injuries that we've already discussed, we like to see them beforehand, before they see us in the trauma center. So of course we take care of them acutely and provide all of the resources once they've had that injury. So ensuring that they have good social work services, that they have mentorship. We have a violence intervention program where they both them and their families are given wraparound resources to help them through their traumatic event. So we take care of them acutely, but prior to them ever being injured, we offer them to come into our trauma center and our Engage program. And they come in, both students who, I heard this term from the Director of Violence Prevention DC, so it's not my term, but instead of saying high risk, but students of promise come in to the trauma center and are exposed to some open wounds. As Dr. Williams mentioned, he's able to talk to them and you hear different stories about how they've been affected by trauma, but then they get to go through some real trauma. We take them into the trauma bay, we put them in all types of trauma gear, and run a scenario as if one of their colleagues have been involved in a trauma, and they get to see that process up front, hoping that it will, help them realize this is not the place where you want to be, and how good decisions and good choices help us not to be here. But they also see the academic side. They get to see physicians and nurses that look like them. They get to go into the operating room and see different procedures and see how this operating room works. Some of them have never even seen or understand what it takes to be in the medical profession. And so we go through that process. We also reach out to different schools, people of promise, schools of promise that need resources, and we provide school supplies for them, food for them, and try to be a resource, provide curriculum and people to do different presentations so that they can hear from people that they may not have ever heard from or understand. So that's part of what we're doing here at the Trauma Center.
That's some awesome stuff. And I'm like giddy because I'm loving your language. Children of promise, promise schools. So I use the word hope. Kids at hope. No exceptions, right? We believe in them, no exceptions. So I'm loving that. Thank you for sharing what's going on. One of the things you said, it is so real. You talked about the post-traumatic stress, the post-PTSD, I'm going to call it, that our children are faced with. And it reminded me in the work that I do in our county, and the work that I do and part of my job is to deal with those kids who violate the code of conduct in a very serious manner. And I remember I had a case and I was talking to one of the young men who had a weapon in school. And I said to him, why are you carrying that weapon? And did you know that kid who you plunged at? And what he said to me was profound. He said, no, I didn't know, but in my neighborhood, I didn't know what he was doing. And all this was an innocent bump in the hallway. Our hallways are crowded in our schools, kids trying to get to places, but it was an innocent bump. But what he said to me was, in my neighborhood, I didn't know what he was going to do. He bumped me. I reacted because that's how I have to react in my neighborhood. And I thought, wow. So when we talk about this post-traumatic stress, right? When we talk about the discipline data, you talked about discipline. And I know that, of course, and probably everywhere, the discipline numbers for African-American students, referrals and suspensions are much higher than their other counterparts. I can tell you that even this year alone, we are seeing, it's funny, I pulled the data. I pulled the data from 2018, September, 2021, September. Our office has been busy. I thought the numbers were going to be extremely higher. Actually, the discipline data in 2018 was higher than what we experienced. However, what I said to my colleagues today is the behavior we're seeing is a lot more aggressive. It's a lot more aggressive. And I keep going back to these kids have been home for 18 months. 18 months. At least they would be able to come to school every day and get away from their adversities for 7 hours, 8 hours, have some reprieve, tell a caring adult what was going on. But they've been home for 18 months. And so we can only imagine what our babies have been going through. So that leads me to you, Shirley Jackson Avery, who is our guru in Anne Arundel County. What is happening in Anne Arundel County with our youth? How are we helping to mitigate this thing we call trauma, behavior, all of that? What's going on, Shirley?
So thank you, Dr. Ashworth. And it's a pleasure to be with you tonight and have this opportunity to share information with the audience about how school counselors are supporting students in Anne Arundel County Public Schools. So I want to begin with sharing a little bit of information about the Office of School Counseling. Next slide, please. So in our office, we have 2 coordinators, and we guide the work of 261 professional school counselors across elementary, middle, and high school. And our counselors deliver a comprehensive school counseling program that's aligned to the American School Counseling Association. And it addresses the academic, personal, social, and college and career development of students pre-K through 12th grade. Now, by design, our services include 3 tiers of level support. Tier 1 is for all students. Tier 2 is for some students. And Tier 3 is our most intensive service, and that's for individuals. So we work with our school psychologists, our school social workers, our pupil personnel workers, and also our school nurses. That's who we work in collaboration with. Now, I will tell you that school counseling, we began preparing for the return of students immediately after schools shut down. And we understood that students would need a lot of support in order to re-engage and reconnect with school. And no matter if they were out for a week or if they were out for a month. And who could imagine, like Dr. Ashworth said, that we would be out for 18 months. So we put special emphasis on preparing our school counselors, because as counselors, we know that we have to be well in order to service others. And so we placed a strong emphasis upon self-care. And in our office, we wanted counselors to feel confident in their ability to address student needs. So we partnered with some of our outside agencies. We brought in the Chesapeake of the Hospice, and we brought in Anne Arundel Counseling, and they delivered professional development to our school counselors that was directly related to grief, to trauma, to loss, to addressing anxiety and depression. And so as we have returned to schools, next slide, our counselors are meeting with students to address COVID safety concerns. And so a lot of students are afraid of catching COVID. And we spend a considerable amount of time listening to their concerns and offering reassurance about our protocols and teaching them strategies to help them cope. We have a lot of students that we're seeing regarding their fears around COVID, especially our younger ones. Of course, we're making referrals, sadly. We're making referrals to DSS for physical and sexual abuse, and the stories can be heartbreaking. We have students that are going to their trusted adults right now and revealing stories of abuse that have started with the pandemic, that started during the pandemic, and they are very heartbreaking. We're also working with students who make self-harm statements, and oftentimes they're making these statements out of frustration. So we work with them on replacement language and trying to drill down to give them words to use when they're frustrated. Okay, trying to drill down to what's causing this frustration. And then for those with serious concerns, we're connecting them to mental health services. We're helping to resolve school avoidance and school refusal issues. We're working with anxious students going into the classroom, and we're doing a lot of breathing exercises, a lot of coping strategies, and even some mindfulness. And then of course, we're connecting our families to outside services and resources. Next slide, please. And so we know that grief and trauma can affect people differently, and especially students who've experienced trauma in the past. And so we want to intervene before it becomes a mental health condition such as depression and anxiety. Next slide. The pandemic caused many students to suffer from ambiguous loss, which is the kind of loss that occurs when there is no closure or there's no clear understanding of the incident. And with the pandemic, things just closed without warning. And it left students in a state of instability and confusion. And some kids are worried about what else might happen. Can this happen again? And so it is much harder for us to help students move on from ambiguous loss because they want answers. And sometimes there aren't any answers. Next slide, please. And so how are we providing support to students? So incidents of grief and trauma can significantly impact their learning experience. And students can't effectively learn unless they feel safe and connected to the classroom. So school counselors play a critical role in helping students access support when needed, and also helping teachers create environments for learning to take place. Next slide. So we placed intentional focus upon the 3 R's. Fostering relationships, reestablishing and setting routines, and also building resilience to overcome adverse situations and challenges. Next slide. So when we talk about relationships at every level, we establish community building circles so that students would be able to discuss their concerns with trusted adults and also with their peers. We reestablished and reconnected students to routines. That was to help them with the uncertainty that they were feeling and also the anxiousness. And in almost every elementary classroom, we have calming areas for students to use when necessary. And finally, there was a major focus on resilience and helping students keep things in perspective and for them not to become overwhelmed with the negative thoughts. Next slide. So as I mentioned earlier, our services are multi-tiered and multi-domain. We address academic, personal, social, and college and career on 3 tiers of support. Tier 1, universal programming, which serves all students. Tier 2, interventions designed for small groups of students. And then Tier 3, this is our most intensive, like I mentioned before, and this services individual students. So let's look at some of the supports that we have at each tier. You proceed. Thank you. So Tier 1 support, we have our delivery of our school counseling curriculum, and we deliver that curriculum, actually it's pre-K through 12th grade. We expect for all of our counselors to go into the classroom on a weekly basis. And at the upper levels, then they get in, usually it's like once or twice a quarter, because they do a lot of the individual counseling with students. We also establish structures at each level. So for elementary, they have their wellness time, and that's when they do their community building circle. They might do second step. At the middle school level, they have what's called advisory, and they have wellness, second step, and community building circles. And then at the high school, they have a wellness block. And so we have partnered with Johns Hopkins University, and we are developing the curriculum for the wellness block. We have whole school attendance initiatives. So of course, many of our schools are PBIS schools. And so they have a lot of incentives and initiatives going to entice students to come to school, because we can't serve them unless they are there. And then one of the other things that we have implemented this year are 4 documentary screenings around mental health topics. And so we introduced the curriculum to middle school and high school, but those documentary screenings are for our entire school community, parents, students. And so right now on our website, you will find a link to our Upstanders documentary, and that deals with cyberbullying. Next on our agenda will be Angst, which deals with anxiety. And then we're going to show a film about like, and this deals with social media and the impact of getting a like or not getting a like. And finally, this year, we're going to close out with a documentary about race and the impact of racism on mental health. I encourage you guys to join us. Tier 2 supports. Next slide. We have hired contract staff. For the first time, I have a counselor who's traveling around to different schools and providing support. And if you know anything about the shortage in teachers and counselors right now, this is kind of big, and I'm very excited to have a person that can go around and provide support. We're also hiring college career coaches that will be working with our students at the high school level. We receive training on outdoor wellness spaces, how to use the outdoors to help students calm down, how to help them cope, how to help them just feel the outside and what that does to them when you're working with them in a counseling setting. This year, we're going to implement mental health clubs at select high schools. That's coming, that's under a grant program that we have. And then we even offered group counseling sessions during the summertime. And we plan to do that again next year. They were very effective for our students. And then of course, for the academic side, because I told you that we address all domains, we have academic tutoring and support after hours. Let's talk about some of our most intensive supports at the tier 3 level. Next slide. So we have expanded school-based mental health. And these are providers in our school who operate under special permission. We have Children's Guild, Thrive, Innovative Therapy, Villa Maria, and Army Behavioral Health. And so they work with students, and we just received a grant that they can work with families who don't have insurance. So that's very big for us. Before we weren't able to refer students unless they had insurance. Well, now we can do it even if they don't have insurance. So we know that our referrals will increase. We also have the STAR program, and this is where students can go on the high school level, can go to the nurse, and they can talk to a substance abuse resource virtually. They can access that support without anyone knowing. We're expanding that to middle school. We're very excited about that. And then we have a central office team that goes out and we consult with principals and consult with school-based staff on individual student cases. We brainstorm interventions and come up with plans for helping students and helping families. And then finally, we have early childhood behavioral intervention that's called ECBI. And they provide direct behavioral support in the classroom as well as therapy at home. And so we're making a lot of referrals to our ECBI. Next slide. So finally, we really want to strengthen our family to school connection, and we need your help. We can't help students unless they come to school every day, and we need to get them reconnected to learning. So we need your help in that effort. And we want you to encourage your child to seek support when necessary. We have many trusted adults at schools, counselors, social workers, school psychologists, teachers, learning lab. Everyone wants to help, so we want them to seek support. One of the major things that would help us is that when you have concerns about your child's mental health, that's the time to talk about it, because we have to normalize these discussions related to mental health. We have too many children, too many students suffering in silence, and we have to remove the stigma around discussions about mental health. And we can help you find appropriate resources. And then finally, I want to encourage you to just stay abreast of our initiatives in any of our upcoming AACPS events by visiting our county webpage, aacps.org. Thank you for this time, Dr. Ashworth.
Ooh, you said a lot. But I am proud because I work in the county, so I'm glad to hear all this fabulous stuff that's going on. And some of what you shared brought me back to, I want to go back to Dr. Brown's data. Dr. Brown talked about the resources, right? That in 2019, there was an improvement in our African-American families. However, there was also data about us, the prenatal, and not accessing those resources. But then I hear on the school side, we got a lot of resource offering going on. So I'm gonna throw this question out to anybody. What's happening? We have resources available, but our families are not connecting. Dr. Brown, do you have a response? Avery, Hazelwood, even Mallory, I'm bringing you in. Why we have the stuff, why aren't our families connecting?
Can I just mention one barrier? I really think the insurance piece was a barrier. And so many people were not comfortable with giving up their information, or they didn't have insurance. And so we were able to secure a grant that you don't need the insurance piece anymore. And that way, that just started this year. We're hoping to get more people who need those services involved and wrapped up in that family therapy.
That's awesome. And I'm gonna put you on a hot seat for 2 seconds. How do our families know that now exists for them?
Well, Dr. Ashworth, I'm going to be honest with you. We just got the word about that last week.
Okay.
And so I have been putting this out to school counselors and trying to make sure that they get the word out to families. We meet every month with our providers, and so we're hoping to see an increase in those people who are accessing services. And if they're not, we're going to do a blast out, because we need to get that information out.
Absolutely. Thank you so much. And Pam, I'm coming to you because you are around the county, and I know you do lots of focus groups with all kinds of people. Why aren't our families accessing resources that are available?
I think there's a real lack of trust in systems. I personally don't trust systems. So I can well imagine that African Americans have lots and lots of reasons not to trust systems, particularly medical systems, but all systems. There is a terrible history with the medical system and African Americans, with the behavioral health system and African Americans, and that's part of it. I think we don't know how to communicate with our neighborhoods. I think that's another thing. We're still using traditional methods of communication. I think too many people don't look like our families, and that's a whole other issue that's part of it. So I think it's a multitude of reasons. And I also think that what we think of as trauma, others think of as economic issues, not necessarily depression, but when you don't have a decent house to live in, when you are working 2 jobs, when you're getting paid appallingly, when all of the other things are happening around you, is that mental health that you would go seek treatment for, or is that the unfair system that you live in? And so I think it's all those things, all of them, and we have to think of answers for those things.
Right.
You said it, and you hit it on the nail, Dr. Brown, and you're so correct. So generational, right? Our families are experiencing this thing we call generational trauma. And it's not, like you said, I'm not traumatized. I don't have any issues because I didn't seen mama, grandmama, great grandma, and so on. That this is how I grew up. This is the way life is supposed to be. Deep. Dr. Williams, you came off mute because you got something to say. Let's hear it.
Yeah, I think if we look at Michelle Alexander's The New Jim Crow, if you look at Ibram Kendi's Stamped from the Beginning, you begin to go back and really examine these purposeful policies that produce what we see. I also think that Dr. Brown is right on point because I really do think that we underestimate just how broke things are, right? And so when you underestimate just how broke the thing you're trying to fix is and you throw resources at it, you become frustrated because those resources aren't giving you the turn in the curve that you would like to see, but it's only because you underestimated just how much it's going to take to turn this around. So COVID-19 alone, without any of the baseline issues that Pam really dealt with, COVID-19 alone will probably set us back a decade in terms of schooling, at least, right? And so we have to really be honest with ourselves about what we are doing and what we are facing in terms of really getting a significant turnaround in what has been generations of dysfunction. And we have to celebrate, therefore, the very modest things that we do achieve because it's meaningful, because we're really in the face of some unimaginable forces. So let me just say, let me say this, Sean. DC, the nation's capital, 29% of our homes have no broadband. If you look at high speed, this is in your nation's capital. If you look at high speed internet and who has access to that, well, Latino and African American children are disproportionately in the group that don't have access to that. That impacts how they have been learning for the last 20 months. So what Howard University's Trauma Center does, which is quite extraordinary when you look at what a trauma center should do, is we invest in computer labs that begin to get at that digital inequity that are in the community at the community center level. So who would have imagined 20 months ago that actually having robust investment in community computer labs where people could go to and engage the educational system would have been the thing to do for us to weather the storm to get through this pandemic that we're going to, that we're going through. We talk about at Howard University the idea that hurt people, okay? And we deal with these issues in ways that are not just one-on-one. We have hospital-based violence intervention programs. Ours is called Triumph. But we also deal with these issues, and we have to think about this as people who are vested in the cures. How do we have radical things that can really change the landscape, right? And propagate very fast. Okay, it's almost like businesses, the hedge funds are looking for radical ideas to grow profits. We have to look for radical ideas that are going to reverse the systems that we are fighting against. And so, what do? We wrote a book. And the title of that book was Scars That Scar. And the whole hope was that in talking about a child who had scars from a gunshot wound, and creating a narrative and a story around that, of how that child could grow to be accepted within their peer group, having to change every day in gym class, and then find out that all of the people that they feared that wouldn't accept them also have their own scars, that this could be the Beverly Clearly of our generation. And oh God, it's me, Margaret, if you happen to be of that generation, of that gender, okay? And we would spread the book amongst the kids, and they would begin to learn how to be a friend to someone who has been hurt, right? Because let's talk about that. Where do our children learn how to be friends and kind to people who have been hurt? Where's that story broached? I'm a fan of Sesame Street, Electric Company, and Zoom. That content wasn't there when I was watching it. Okay, so we have produced literature and put that into the space, and now we've got to do what we have to do is to take it from the paperback form and put it into the social media field, so that now it's even more available for people to know about and understand, and it's more reachable by our children. But those are the kind of things, the real radical changes that we're trying to be a part of as a trauma center, understanding that ultimately when we take care of patients who are injured, it is a sign of the failure of society. It's not a success, it is a failure, and we need to be interdicting upstream much higher.
You are absolutely right. And you talk about radical moves. And my mind again went to, I think one of the radical moves that Anne Arundel County Public School has made and been making over the last couple of years is this idea of every school being trained in restorative practices. And with restorative practices, and Ms. Jackson Avery talked about our schools, especially in our elementary schools, are having those community building circles. And what you were talking about, Dr. Williams, in community building circles is where we teach that. How is it to be kind? You know, identifying. I always tell this example every time I'm one of the RP trainers in our district, and I was supporting a school a couple of years ago, an elementary school, and I had the fortune of running a community building circle in a third grade class that I had been supporting. And when I tell you, I led the meeting, the circle that morning, and I asked a question about, you know, what was your favorite thing about coming to school, or what are you most happy about coming to school? Let me give you some context. We had a bully in this class. He bullied everybody in the class. This particular morning, I asked that question, and the kid who he bullied the most said, I didn't want to come to school because my dad made me stay up all night to do homework, something like that. When I say for 3 seconds, that bullier and the kid who he bullied, once the bullier spoke, because he said, I want to come to school because my dad wouldn't walk me. When I say for 3 seconds, those two young men locked eyes. And what they said without saying it was, you're just like me. We have something in common. That bullier, they didn't become best friends, but he stopped bullying that young boy. And so when you talk about where the kids learned that, Anne Arundel County made a radical move when we said every single one of our schools is going to have RP trained staff. And every one of our elementary schools, middle schools, and high schools, they do it a little different. And it's probably during that mindfulness period that Jackson Avery was talking about. But there's a time in all of our schools, at some point in time a day, we're talking about that. How do we treat each other? That although we may look different, although we may come from different neighborhoods, we actually have something in common. And that's why it's just nice. A lady in my church would say, it's just nice to be nice. In schools, we talk about being kind, being kindness. And so thank you for that. I want to throw out a question to each of you. Last night, we talked about the healing ointment and what that was and healing the trauma. Like, what is that healing ointment for our youth that is going to help us close some gaps, close some opportunity gaps, close some economic gaps? What is that healing ointment? And I'll let either one of you to begin with that.
think part of that ointment is creating a foundation for communication so that youth have that person that they can go to start just talking about life. Dr. Jackson Avery talked about the programs that Arundel County has, but just like healthcare, is there real access to those programs? So you have them at school, but are we bringing them to the families? Because as we've already stated, it may be a single parent, mom's working multiple jobs, maybe she's in school. How are we getting that access to that family instead of just school? And then when the programs are presented, how much are children involved in the programs? One thing I realized with my own daughter is that kids just aren't kids anymore, the way we used to think about them. And if we can, for example, combine one of the programs that we work with here at Howard, the DCU cycling, where they are building using STEM technology to build bikes. So they're utilizing their hands, learning the STEM knowledge. Then how can we bring in the mental health piece in that program? So I think thinking outside the box to bring programs to these children and essentially to these families can start healing them in a way that we like to see them purposefully heal.
Yeah.
Thank you.
Yeah. I like that a lot because I never thought of the bikes program as an opportunity for mental health, but it actually is. I think, Sean, children want to be loved. I think they want to be heard. And I think they want to intuitively do big things, right? I always ask myself the question, why does the hellion get in so much trouble? It's because they want to, deep down inside of themselves, do very big things, right? So it's just about really redirecting the energy, right, into a more productive, a more productive way. And so if we're honest with ourselves, we can understand that the deterioration of what the nuclear family has been defined as in America has taken place and been in place for over 2 decades now, easily. And some, if you go back and follow the politics long enough, would say that we're probably 50 years into this descent. If you really look at divorce rates, if you really look at single parent homes, if you really look at what communities look like and what families are composed of. And that, we can get hung up on that, but it really, now we have some opportunities to begin to think about, okay, is this our floor in terms of actual hardcore resources to then rebuild? I think we do have to rethink about how the family is going to look if we're going to move forward in a rapid way. I can't get hung up in where the resources are coming from, what color the resources are. It may be even so desperate that I'm not as concerned about some other things that really are important, like cultural competence. Okay. We may be at a point, dare I say it, where we just need some love. Maybe it's some imperfect love, but hell, we've been given some imperfect love and we supposed to be culturally competent. So we may just be really in need of right now, who wants to love this child? And then let's deal with everything else as a distant second. And then begin to now throwing love in that child's direction in such a way that there's a space, right, to turn the thing around, right? I really do believe that our politics sometimes gets in the way of the success. See, a football coach don't care how he win the game. Field goals, safety, It doesn't matter as long as he get the points on the board. I think we have to begin to adopt a little bit of that mentality, okay? And so I want the child out of foster care. I want the child adopted in a sane home, doing sane things, sane expectations. Doesn't have to be perfect, but some structure, right? And all of the other politics about the other stuff is probably needs to be a distant second and a third. And so I really do think that we have to be aggressive on getting children into spaces of love, right? And then everything else, we have to concede that point. That's our democracy. We make compromises, and I think we're in a position on the child, on the family issue, where we really need to be placing children at a very fast rate into places that are safe, that are sane, and that have love. And then pushing all of the other stuff to the side, and then trying to do everything we can to support those families to bring those children forward, right? I think that's where we're at. And that includes how we look at families for adoption as well. By the way, that process is a little bit too long and drawn out in terms of getting children into good places of being.
Thank you, Dr. Williams.
I think there are I can only think of it like as levels to this. So there's the level of the political, and I feel that we are all responsible to do what we can to change what has happened, to keep chipping away at the policies, to keep chipping away at systemic racism. We are all responsible for that. I take that responsibility and I chip away at it wherever I can. And I think every single person should be doing it. So that's at one level of history and politics. And then there's a level of trauma. We know a lot about trauma. We know what helps people who have been in trauma. We know what helps children who have been in trauma. There is no reason why all of our classrooms are trauma informed, where our foster homes are trauma informed. We know how to speak to trauma victims. We know how to love trauma victims. We know what makes them feel safe and what makes them feel scared. There is a whole set of techniques around trauma that all of our systems should be well aware of, including the criminal justice system. There is no reason that everybody is not aware of that and the disproportionality in trauma. And then there's the individual level that we've been talking about. And what we've known forever and a day is that one caring adult can make the difference in a child's life. And we've known that forever. And frankly, I've never met a child I couldn't connect with. You've got to respect children. You've got to always be both physically and in every way at their level and sort of in an acceptable space. And then, as you said, we've just got to love them. We've got to love them to life. And I laugh at that because my daughter-in-law had a child that was huge birth defects. And I always say that her and her mum and the family loved that child to life. They loved him to life. He is now a completely normal 6-year-old in first grade, doing fantastically well. And I watched as an entire family loved that kid through his birth defects. We can do that with every child. Every child. You can love them to life if we choose to. So to me, there's all different pieces to this. What we can do individually, what we can do inside our systems, what we can do politically, what we can do in terms of economics, how we can speak out as human beings about what has happened to African-American children, how we can raise consciousness like we used to do in the 1960s around that. I mean, there's nothing we can do, and this is not overwhelming. There's everything we can do. And more to the point, we know how to do it.
That's awesome, Dr. Brown. And I was just thinking, this whole idea of love. And oftentimes when I do my professional development with teachers, I talk about not loving children into failure, because sometimes, it's okay.
Yeah, you don't.
You don't have to do your homework. I heard the lights were out. That child gonna do their homework. They're gonna come in during lunchtime. We are not gonna love kids into failure We're going to help them be resilient by saying, in spite of, I know the power's out at home, but we're not making any excuses. You're going to do lunchtime, lunch buddies, come on in and get that math work done. And so, yes, we do need to love them, but not love them into failure.
Yes.
Jackson
Sean,
Angry, yes.
Sean, I just wanted to mention, I totally agree with Dr. Williams and Dr. Brown and Kenyatta. We have to have advocates that are going to go the extra mile for kids, going to stand in the gap. And what we tell our counselors is that it might be uncomfortable, but you are going to have to challenge any inequity that you see happening, because you have to fight for your students. You have to be the one who's standing in the gap. And so we remind them of that all the time. Go above and beyond. You are that person who can do that. And that means reaching out to families. When the teacher doesn't call, you call. When the child needs to know what's going on, or they need to know what event or where to be, you call. And so we encourage our counselors to do that each and every day. But of course, we need families. We need support. We need help. We need a Dr. Brown in our school, right? We need her. We need Dr. Williams. We need Kenyatta. We have to have those partnerships. And we have to have people that question what we are doing so that we can make it right for kids.
Absolutely. I could not have said it any better. This esteemed panel tonight, you guys have hit so much, so much. We have I'm going to say about 6 minutes. Are there any lasting words? Anything else? Any more healing ointments that you would like to share with our audience? Dr. Brown, I did get a text about your PowerPoint. Is it okay to share that?
Absolutely. Yeah.
Okay.
No power, no, yeah, it's all open for anybody who wants it.
Awesome. Thank you.
I guess I will say I'm a bit encouraged. So a bit encouraged. So one of the things I do for the county, as many of you know, is the community needs assessment. And I've been spending a lot of time at every level in the county, at high levels, every level, CEOs of hospitals. And I've been asking questions about equity and race. And I have actually been pleasantly surprised at the consciousness that has been built through the pandemic of issues related to African Americans. There is much more awareness, and there's actually the beginnings of looking inside systems and saying, how are we contributing to that? And I'm not, I'm not, wow, we're there, but I'm a little bit encouraged that we are starting to really look at what we've done and start to think about how the heck we fix it. And that has encouraged me.
Thank you so much. And I just want to thank all of you this evening, our esteemed panel, on behalf of the collective. You all who are out there and just in the trenches, thank you for sharing your work with us. Thank you for our Facebook and our Facebook and Zoom audiences who have joined us tonight. We've heard some startling data, and I had someone say, I'm still trying to process that data that Dr. Brown shared. We had some startling data, but we also, I don't want to say but, because I'm trying not to say but, and also, we also have heard some healing ointments. And hopefully the healing ointments that we heard this evening will address the disparities that we're seeing in the data. We heard we have to think out of the box. We got to put children in spaces where they feel the love, they share the love, they act in love. We have got to be trauma informed throughout all of our systems. The systems, and I say this all the time, even as an educator, sometimes we are the biggest barrier to our families getting what they need because of the processes and the protocols. Just become trauma informed, speak the language, show the language. When our families are visiting businesses and banks trying to get loans, just understand where they're coming from. I just, again, want to thank each and every one of you for joining us. Don't forget, part 3 is tomorrow evening. Join us again at 7 p.m. on Zoom, this same Zoom channel, this same Facebook channel, because tomorrow, and although we've been talking about it over the last 2 days, tomorrow specifically, we're going to talk about trauma and our families. So on behalf of the collective, I want to say thank you for joining us, and have a great evening.
Thanks, Sean. Thanks for inviting me. It was lovely to meet you all. Thank you.